So today we are going to discuss what other organs besides the kidney are affected by chronic kidney disease. For those who see me for the first time, I want to introduce myself. I'm Dr. Francisco. I'm a specialist kidney doctor and a transplant immunologist working at Francisco Kidney and Medical Center in Singapore. Welcome to the bite-sized information for kidney and related diseases. This video blog was created to help patients with kidney problems or their relatives or patients at risk of kidney problems to be better informed so they can take better control of their disease, minimizing complications and minimizing worries. And they can improve the management with their own doctor or with me if they choose me. So let's start. How the rest of the body gets affected by chronic kidney disease. With chronic kidney disease, many other organs get also affected. The heart, vascularized organs, that means organs with a lot of blood vessels, the brain and nervous system are common targets. For instance, patients with advanced chronic kidney disease and even more with total kidney failure are at increased risk of heart attacks, heart failure, or erratic rhythms of the heart, so-called arrhythmias, that can even end up in the heart going to stillness. That means stop. The blood pressure can go very high, and this damages many other organs. Severely increased blood pressure can precipitate a heart attack or stroke, or a bleed in the eyes. If the potassium levels go too high, it can even make the heart stop. This can also happen with other abnormalities in other electrolytes. The bones can become fragile, leading to pain, deformities, and fractures. The muscles can also become very weak and suffer from painful and sustained cramps. The blood vessels can become stiff, which can cause circulation problems to many organs. Then the function of those organs can be impaired. The circulation to the heart, to the brain, to the legs, to the genitals, etc. can be affected. The nerves of the body also can get affected, and the patient can have loss of the sensation of the skin, abnormal movement of certain parts of the body, especially the legs, and impaired function of some organs, as all organs depend on a healthy nervous system. The skin becomes dry, which exacerbates the itch accompanying kidney disease, and scratching predisposes to infection. Organs like the liver can also not work that well with high levels of toxins, and the liver is also an important detoxifier of the body. As the kidney disease progresses, the patient becomes more and more malnourished, losing flesh and strength. This, together with weaker muscles and some electrolyte abnormalities like in the sodium, can predispose to falls and all the consequences of falls. There could be fractures, could be hitting the head, could be a bleeding in the head, or even dying. If the patient becomes weaker, he becomes susceptible to transmissible infections, or he or she becomes iller if suffering from any infection already. The mood of patients also changes, going downhill. This might be the effect caused by the toxins or the psychological effect of knowing having kidney disease. In Francisco Kidney and Medical Center, we are very aware all the complications that patients can suffer and all their implications. I provide empathetic, approachable, and flexible specialist renal and medical care because I can imagine what are the struggles my patients have. Also, what are the struggles the relatives and all the worries that relatives can have. So it is very important to take not only the physical, but the mental well-being of my patients and their families. If no other comments or anything like that, so I say bye, Dr. Francisco, wishing you the best possible health. Take care, bye-bye.